Well, I want to thank everybody for being here. I want to thank Chancellor. Chancellor, thank you for being a part of this. Dr. Zerwas, Chief Nimkid, and Dr. Hellerstedt, who are part of our team, and their leadership is very much appreciated. I do want to start out today by expressing my heartfelt and deep gratitude for everybody in the medical profession, doctor, nurse, assistant, whatever role you play. The role that our medical professionals are playing is pivotal as we continue to fight back against COVID-19 in the state of Texas. We're engaged in a war against this infectious disease, and the warriors on the front line of fighting that battle are those who are the healthcare providers, and we cannot thank them enough for what they are doing. One reason why we are here today is to provide good news for those frontline healthcare workers, as well as good news for everybody in Lubbock and across the entire state of Texas. The good news is this, and that is the first medical treatment that has been made for COVID-19 has now arrived. It has now arrived in Lubbock. It's also arrived across the state of Texas. It is the Eli Lilly antibody therapeutic treatment. It's like the drug that was taken by the president that helped him recover so quickly from COVID-19. Its best use is for the early stage of COVID cases in patients who are in the early iterations of COVID-19. And the goal is to give it to them at such an early date that it will keep them out of hospitals. And that will be one of the strategies used to make sure that we are able to reduce hospitalizations, whether it be in Lubbock or any place in the state of Texas. And so that's the goal. The goal is to both heal Texans as well as to ease the burden on hospitals in Lubbock and elsewhere in just the coming weeks. What we have with us here today are a couple of charts that show you exactly what we're talking about when we talk about this Eli Lilly therapeutic drug. This is a closer up model, and it shows you both what it looks like and how it works. On the left-hand side is a bag that contains the antibody therapeutic in that liquid bag. It takes an hour for that liquid bag to be infused, just like a drip in a patient. You can see the drip stand that looks like any other type of drip that you would see in any type of hospital setting. And all it takes is 1 hour, and then the treatment is complete. And so this is something that is going to be increasing meaningfully both here in Lubbock and around the state. So Lubbock has already received its first allocation of this drug. There will be additional allocations made on a weekly basis that will continue to add to the current allocation. And these weekly supplies will continue, especially when you put into context all of the medical resources that are being harnessed and being brought to the table. Because in addition to this Eli Lilly antibody therapeutic drug, we do anticipate beginning to get the clearance for and then the receipt of the antibody therapeutic drug made by Regeneron, which was the manufacturer of the drug that was taken by the president, that provides the same type of treatment that Eli Lilly drug is providing. And then that will be added to in the coming weeks by even more that will help treat people who have COVID, and more that will prevent people from getting COVID. Because the more good news is that over the course of December, we are anticipating more treatments, but also we are anticipating 2 vaccines to be approved in December. One by Pfizer and the other by Moderna, and there could be more than that. But both Pfizer and Moderna have shown an effective rate of 95%. That's an extremely high effectiveness rate for a vaccine. And we, as in the state of Texas, are already prepared structurally for the quick distribution of those vaccines once they are approved. This is a process that the governors of the United States have worked in collaboration with the White House on to make sure that we were fully prepared to distribute these vaccines across the country and across the state as quickly as possible once they arrive. And again, we are expecting the arrival of those vaccines sometime in December. So in addition to the medicines that we are providing to the Lubbock area, with the help of Chief Kidd, as well as everybody involved in all the different organizations in the state of Texas. The state has provided Lubbock with 327 medical personnel currently working in Lubbock, 950 personnel currently working to support Lubbock and Amarillo, and 1,278 personnel approved to support Lubbock and Amarillo if needed. In addition to that, we have added increased supplies for PPE, including over 1.1 million masks and hundreds of thousands of coveralls and gowns. In addition to that, we've set up auxiliary medical units with bed capacities at Covenant Hospital at the University Medical Center. And so these auxiliary units may be some of the locations that will be used to deliver these antibody therapeutic drugs. And in addition to all of that, we have set up testing sites, COVID testing sites in Lubbock. There are 3 testing sites open from 10 a.m. to 4 p.m. daily to make sure that people are going to be able to gain access to the testing they need to learn whether or not they may or may not have COVID. While we wait for increased volumes of these antibody therapeutic drugs as well as the vaccines, it's important for everybody to remember the habits that got us through the spike of cases of COVID-19 in July. Everyone knows that we have an increase in COVID-19 in Texas right now, but everybody also knows this is not our first response to this challenge. There was an even greater increase in COVID-19 cases, a greater increase in hospitalizations in July. And we learned at that time exactly what needed to be done in order to crush the spread of COVID-19 in Texas. And Texans joined in together to make sure that we did slow the spread. And it's going back to those very same simple habits. You will not get COVID if you do not expose yourself to COVID. You can prevent yourself from being exposed to COVID if you keep your distance from others, if you stay indoors if at all possible, if you wear a mask if you do go out, if you sanitize your hands frequently. And so these very common practices were perfected by Texans that led to the crush of COVID over the course of late August and through the month of September. We've been there before. We can do it again. All we need is for people in the Lubbock area and across the entire state of Texas to return to those safe practices that we learned over the course of the summer. And then just one larger concept, and that is, it's so easy to let our guard down, thinking that maybe COVID-19 has passed. And all we need to do is to bring that guard back up. And if we do that, we will get through this episode just as we got through the episode during the months of July and August.